Good morning, Dr. Lebo, Gyno and Beyond. Sunday morning, beautiful case today. This 30-year-old local guy from New York who has a gynecomastia and beyond. You know, of course you can say, don't waste your money, get into the gym, work out, eat better. You know, of course people can say that, but in lives and daily activities, that's just not possible, and that's why I'm here. We do, on this guy, we're doing gynecomastia and beyond. We're going to do Vaser high definition power system liposculpture of the chest, including the mid and upper belly, even a little bit down below the belly button, through 5 stealth incisions in the armpits, nipples, and inside the belly to sculpt, etch, define, and reveal all the muscles to whittle him down. Get this gone, 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 get this gone. We're going to do skin tightening, because if you bend him over a little bit, do that. He's loosey-goosey. We have to tighten all that up. We're going to remove the glands, of course. You always have to remove the glands. And finally, we're going to do lipofilling, mainly with him, the pecs. See how he's deficit here? I want this to pop. I want this to be gone. Give him an athletic, lifted chest. Also, the deltoids, maybe even a little bit of the lats once we get rid of this fat between the pecs and the lats. We can even do a little bit of the biceps if we want. It all depends upon how much purified fat that we have. All safely, comfortably, dynamically done under local anesthesia. So Lebo, Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Now let's watch the markings. All right, so now these are my markings. So that's the midline, and this is the median right here. Suck in your belly. Right there, that's the semilunaris. This is the midline linea alba, and this is the semilunaris here. And we're gonna go, he's tall, he's 6, what are you, 6?
Just about 6'1".
Yeah, about 6'1". So we're gonna go down through 5 stealth incisions. This is the maximum point of indentation right there. Maximum point of indentation right here. We're gonna go over here. So this is framing him. This is where we're gonna go. Next, we're going to make him a happy chest from a sad chest. Right here. Right now, his chest is sad.
Very sad.
It's sad. Very sad chest. And then the lats here, I can even see the lats on him. He's got all kinds of side boob there. So we're gonna etch these lats here. Moving forward from there, we're gonna see where the 6-pack is. Now, suck in your belly. I can kind of see it. Little bit. That is 1, or 2, should I say. And then this line is 1. So this looks like is where the action is. And I do a lot of curving. This is perfect. Perfect. And I always ask my patients, do they want to be dynamic or they want to be moderate? See how this nipple's a little lower? I put here. See, this line is a little higher than this line. You know, people are not symmetrical. So we're going to lower this and lipofill all of that. Anyway, get back to this. Scoop in here. And this needs to go. I want him snatched. Like that. Then we got the serratus muscles. You can kind of see him on this guy. Right there. And you can kind of see the serratus muscle right there. Kind of see it better on this side for some reason than the other side. Perfect. And that needs to go. This is the delt. This is the anterior delt right here. And then you got the lateral and posterior delt here. Again, I want to create wide and then snatched. Right now, he's kind of like square.
A glob.
like SpongeBob SquarePants. He's just kind of square. I got to get all this crap out of there. And that's what makes me, you know, beyond what other doctors do. You know, you want a quick 1-hour operation, a lot cheaper, and have this flat and have like a pear-shaped body. No bueno. No bueno to me. After the black, we do blue. And this really kind of defines where I want to go deeper and create shadows. Lines and shadows. This is And this, of course, I want to flatten out right here. Perfecto. And with this, I make them normal. I don't want them like chiclets or a Hershey bar. You know, I want to make them, you know, so this line here and this curve is actually very important to make them look natural. So that's the trochanteric depression here. I gotta get this all the way down. Red. These are going to show my incisions. Stealth incisions right there. Mirror image over here. Of course, right there. And finally, right inside the belly button. Purple is the lipofilling. And I want to give him some volume up here. Needs some volume. Very, very important. And green means go. Means hold no prisoners. All of this. All of this needs to go. Very important. All of this. All right. So we're going to start an IV, get him in the OR, do some local anesthesia, and get going. Let's go. I grab the gland, this is a local, go right there, boom, easy. And we pump you up.
Pump you up.
So this is Vaser, so this is ultrasound. So this is what I do. I spend about a good half hour or more vasering all the areas that we're doing. So it's ultrasound, melts the fat, melts the gland, and tightens the skin. And I'm going into my different areas. So on my thing, I'm very specific. I'm hitting this gland under and over and around. I can feel where I am over the muscle. Now I'm under the gland, over the muscle. And I go to the first six-pack. And I go right there, that's the tip. Even to the midline. So I want to give him that cleavage. So I go right where the midline is. I put some pressure there. Thin that down. Nice. And from there, go to where the delts are. We're over here. Get to the lats here. Too much fat by the lats. Need to thin those down. Now I'm getting into the right there. Very important. All right, so now we're on this side, on the right side, same thing. Here's the gland. A little there. There you go. Top of the muscle. between the pecs and the delts. Come over, so I want to melt the fat over, because I want muscle, not fat, even on the chest. Top pec, to really etch that top of that muscle. And then right here. You're doing great. Let's get some of this stuff here. You all right? Mm-hmm. Good. There we are. Nice. Nice. My hands, our fingers are where I want to etch. So this is where I'm going very superficial with it. And over here, this is the V to P, I call it. Right down here. Go as far down as I can get. These are the extra long ones. Normally these are 30 centimeters. I've ordered these 40. Now we're in the anterior belly. So with my markings, I put extra pressure right at the inscriptions, which is this horizontal. Now here, we concentrate on getting between. I want to give that nice midline indentation here. That nice linea alba. Come this way. This is a micro air, long. They normally come in 30. I have them made in 40. I also bend it myself, so it's a little bit of a gentle bend and I got one that's even more bent, which we're going to use. And this just kind of vibrates. So the reason why I bend it is I can get to the around the corners, and I even have a bent one even more. So go gently. Now I'm attacking the gland. And you're going to see all this stuff is going to be whittled away into a little pit. And the fat, as you can see, he's great. Got some good fat, not bad fat. I don't know what that means, but he's got good fat. Like making a statue. You get away everything that doesn't look like Michelangelo's David. So I'm creating lights and shadows. So this is my shadow right here between the pecs and the lats. Just the top of the six pack here. This is called Cobra Kai. Wax on, wax off. Right here. See that beautiful right there. Nice, beautiful fat. That's what I want. So I want to naturally blend the chest, so I don't want any heaviness of fat on the chest. So I'll be lipofilling. I'll be putting fat inside the muscle, which actually isn't fat. It is fat, but it turns into stem cells. They actually have done research where post-op people can actually lift heavier. They see how much they can bench press, let's call it, and they can actually lift heavier. And they actually did biopsies like on lab animals, after injecting fat, and they don't see fat. After about a year, it's all muscle, and the muscle volume's just thicker. So you think it's fat, but it's not. Again, look at the quality of this fat. Beautiful. And again, way up here. I see beauty. I see amazing results so far. Darren, Darren worked for me. Got his first tattoo, I think. No? You have a tattoo before you work? Good. Side 2 now. I got 1,200 cc's out already, just on the chest. Alright, so here I am at the nipple incision, and I'm going to get all of this stuff now. See the good fat we're getting out? Prime fat. Now we're going to get, and that's a, see, I'm way down here, see that? So through my nipple incision I can get all the way here. That's really what he wants.
Fentanyl?
I'm going to etch the six-pack, but his six-pack, not a fake one. So this is the midline now. Go up to the neck. All right, so here now, we got him on his side, and I switched it to a 30-degree bend. So this was a 20-degree bend, now it's a 30-degree bend. And I'm just sculpting a little bit more into areas that I want to get. What I'm doing, I just elongated the nipple incisions. Just took out the glands on the one side. Now we're doing Renuvion. So what we've done, we did Vaser, high definition, power assisted liposuction to fine tune, reveal, etch, define, and sculpt his chest as well as his abdomen through 5 stealth incisions in the armpit, in the nipple, and inside the belly button. We took out the glands, and now we're doing skin tightening, and after this we're going to do some fat grafting. There is the fat that is being prepared right there, and we're going to put that in the muscles of power, which will include the pecs, the delts, the lats, maybe the biceps, we'll see. So right now, through the same stealth incisions, we're going to do my wand, and we're going to do skin tightening his skin here. This also I call it the sweeper because it also stops bleeding and it also gets rid of any fat that may be left on my undersurface of the skin.
Beautiful. 3 cc's left.
Good. You all right? Good. Good. Dr. Lebo Gyno and Beyond today, 30-year-old gentleman, local guy from New York. We did Vaser, high definition power assisted liposculpture, Gynecomastia gland removal, and Renuvion J plasma to tighten everything up. We did his chest, the mid and upper, and a little bit of the lower belly, just a little bit, just surrounding the belly button through 5 stealth incisions in the armpit, by the nipples, and inside the belly button. We took out the maximum amount of fat, that's 5 liters from him, so we had to put some closed drains, which we'll take out within a week. He's got some antibiotic gauze by his nipple, but you can see the power of his pectoralis major muscle. Indeed, we did lipofilling. We put 360 cc's of purified fat in each pectoralis major muscle, 180 cc's of purified fat in each deltoid, and 120 cc's of purified fat in each latissimus dorsi muscle. See the perfect prominence of the pectoralis major muscle, the space between the pecs and the lats, the midline linea alba, the semilunaris that frames the six-pack abdomen, and indeed you can see the six-pack abdomen 2, 4, and 6 and he looks great. We snatched the waist, we went all the way down and around to his hips and back through these 5 stealth incisions, comfortably, dynamically, and perfectly done under local anesthesia. So if you have gynecomastia, you call me for Lebo-Gyno and beyond, always beyond, where I include, if you have liposuction, the abdomen, so everything needs to be perfectly blended for perfect results. Call me, Dr. Lebo-Gyno and beyond, 631-424-0101, or email me at jonathanleibowitzmd@gmail.com. We also, of course, did Renew Beyond J Plasma to tighten everything up. Thank you and see you soon. Let's go.